Your client auditor is sitting across the table. They want training records for every analyst who ran their batch, under their procedures, their version, their scope. How fast can you answer? A CDMO managing GMP operations across multiple client product lines isn't running one quality program. It's running several with separate SOPs, separate approval authorities, separate training obligations, and separate audit histories for every client on the floor. Most quality management platforms were not designed for that. 21 CFR Part 211.25 requires that every person engaged in pharmaceutical manufacturing be documented as qualified for their assigned functions. For a CDMO managing multiple client product lines with changing procedures, recurring quality events, and ongoing tech transfer activities, meeting this requirement across a shared workforce requires more than a training system that talks to your QMS. It requires a system where quality and training are the same system and where training records are scoped by client product line, not just by job title. eLeaP closes that gap automatically. When a GMP procedure is approved, training deploys immediately to every affected role, scoped by client product line. When a tech transfer phase gate is passed, required training goes to production and quality roles before commercial operations begin. When a CAPA corrective action is closed, effectiveness verification training deploys automatically. Every client product line, every shift. An OOS result doesn't wait for the morning shift. When an out-of-specification result triggers an investigation, eLeaP QMS manages the full deviation record. If root cause analysis identifies an analyst training gap, a procedure misunderstanding, a missed requalification, corrective training deploys immediately to that specific role. CAPA closure requires documented training completion and effectiveness verification before the batch record closes. Tech transfer is one of the highest risk activities a CDMO undertakes. When a phase gate is passed and new procedures are issued, training deploys automatically to the production and quality roles that will execute the validated process. Smart assignment routes the right content to the right people. Personnel cannot advance through quality workflows until training completion is confirmed. Change control in a CDMO runs in two directions. Changes initiated by the client must be reviewed for manufacturing impact. Changes initiated by the CDMO must be communicated to clients per quality agreement terms. eLeaP manages both directions from a single controlled workflow, with training verified before implementation and client notification built into the process. Qualification records show who was trained on what, by procedure version, by client product line scope, by equipment qualification status in real time. When a client auditor or FDA inspector asks, you answer immediately, from one system. That's what GMP contract compliance looks like when it's built into the platform rather than managed around it. Start a free 30-day trial or schedule a live demo at quality.eleapsoftware.com.